Okay.
Perfect. Great. Great. Well, good morning, everyone. Welcome to the PaCT Coaches Prep for Test Box 3 of the Innovation Hub Team's test items. We'll probably have a couple people still joining, but we'll just get started, and they can join as we go. Just like always, the WebEx features are the same, so you can mute and unmute on your own phone if you have that feature, or if you want to use the Mercury line muting, it's *6 to both mute and unmute. Like always, we will be asking you sometimes to put something in the chat box. So as you know, you can select all participants, or if you're having a message that you need to send to someone specifically, you can choose a name or to one of us if you're having a technical problem, and then enter your text. And then, of course, don't forget to hit send. That is something that I do all the time, is type a message and then forget to hit send. So that's an important point. And again, host if you have any issues. We'll also ask, I know it's always hard on a webinar, but sometimes if you want to come off of mute and actually speak, we think that would be really nice. We like to connect with you as in person as we can be across the province. So please feel free to come off mute as well as using the chat box. Great. And so just as we're starting off, using that chat box, if everyone wouldn't mind popping their name in there, and everyone that you're with, if you're with more than one person around one computer, if you could put both names in or all names in, that would be great. And we'll just get the chat box going. See Monica and Mia, Kathy. Jennifer. Oh, I see Charlotte. I missed you. You're up at the top there. Okay, there we go. Good morning, Mark. Good morning, Lisa. Lisa, if you want to, in the Send To box, if you type or select all attendees, then everyone can see what you're typing in there. Great. Okay, well, I'm going to continue on, but if you haven't typed your name in there, feel free to do that. Good morning. And we will carry on. So just so you're aware, I'm sure, well, you may all be aware that the Test Box 3 items have already been added to the top website. And this is where the guide document is for you, and then the actual Test Box 3 document, as well as the tools that are related, are already loaded on the website. For those of you who might be looking for it, the Share and Learn recording that just happened at the end of May, that will be up on the website later today. If you've been looking for it, it's on its way. But the Test Box 3 documents are already on here for you. And for those of you who've had a chance to take a look at them, no expectation if you haven't, no problem, but we were just thinking this would be a good time to start thinking about any questions or comments that you might have. As you know, as always, we'll go through each of the sections and review in the next hour. that this is the time. If you have any questions or comments, we would love to hear from you. So maybe start thinking about those now. And then just in general, we wanted to know how it's going. We know some teams are blazing ahead, and other teams are being thoughtful and meticulous and moving through at a slightly slower pace, and it's all good. We're just curious to know how it's going. So we'd welcome anybody to come off mute and just let us know, where your team is at and what's going on. Recognizing it takes a moment to come off of mute. Who wants to be the first to break the ice and sounds like someone's come off of mute. Anyone like to speak? How about can I ask Charlotte?
Morning.
Good morning.
I don't really have anything to add right now. Sorry.
No, that's okay. That's okay.
Yeah.
No problem.
I just actually printed it off this morning and was looking at it. So really.
And that's no problem. Like I said, we have no expectation that you've already gotten to it. But just in general terms, like, where's your team at? Are they ready for test box 3, or are they still kind of finishing up some of the other stuff?
Well, I wouldn't say that we're ready for test box 3. No.
Yeah.
There's been Ariel has been off for a month, and Dr. Kruger has now had a family emergency and gone back to South Africa. So, yeah, we've been seeing some patients. Ariel has still been seeing some patients, and we've been doing what we've already started. But yeah, we definitely have not had meetings in the last little while.
Yeah, yeah. And that seems to be the nature of the beast. Hey, it seems like any clinic, just life gets in the way. That's certainly not unusual. So that's okay. We recognize that things come up in clinics, and this is certainly not the priority in any clinic. The work of the clinic comes first, and then, of course, you have to manage issues that come up. So that's okay. You get to it when you get to it, and we're here to support you along that way. Anyone else?
I think.
Oh, go ahead.
Say thank you.
Oh, no problem. No problem. Anyone else? Let us know. Where's your clinic at?
Good morning, Michelle. It's Kathy from Riverside Medical in Drumheller.
Good morning, Kathy.
Yeah, I just, I guess as far as where we're at with everything is we're a new clinic, so we've been in operation for a year, and actually we've kind of been reflecting back on the year. And one of the things that comes to mind for me is that we started new with all of the concepts of patient medical home, and it's become common, and just that's the way it is. And so a lot of the things in the test boxes aren't anything a surprise or new to us, and we've been able to very easily just go, yes, we've got it, or okay, that's a good idea, and we've used many of the resources, and we're rolling along and quite happy and ready to go with test box 3.
Okay, fantastic. That's great, Kathy. And there is definitely an advantage to being a new clinic, hey, and starting fresh with all of this, for sure.
Yeah, exactly. And a smaller clinic, one doctor, one nurse practitioner. So, you know, the team is ready in that direction.
Yeah. And it's nice to have, I know your physician is really on board and really really leading the way with this. So that's also very helpful. Mm-hmm. Would anyone else like to share where your team's at? Again, there's no pressure or judgment. We have no expectation around where teams are. This is a test group, so not to worry. Monica, can I call you? Oh, just see. Let us know where you're at.
Hi, sorry.
Oh, it's okay.
I pushed the wrong button. I think we're ready for test box 30. We didn't pick a lot of things from test box 2, so they're just doing some PDSAs around the huddles right now from test box 2, but that's really the only major task of test box 2 that they decided to really try. They're addressing other parts of it through other working groups and a different initiative, so they didn't want to duplicate the work. So, our team's feeling like we've caught up a little bit. We felt like we were really behind after the first one, but we feel like just now given the chance of kind of picking what pertains to the team at the time, it feels a lot easier.
Oh, great. That's great. Well, that's good to hear, because we were aware that some teams were feeling a little anxious about being behind, so that's why we postponed this delivery of test box 3. So I'm glad to hear that it allowed some teams to do some catching up. So great. And again, like we said, there's absolutely no pressure or expectation because this is a test period. We were somewhat guessing at the interval time frames that teams will need, and of course, every team's in a different situation. So we are just appreciative that the teams are adding this PaCT work into their already busy workloads, and we're grateful for any and all feedback that we're able to get. So thank you all again. So we'll move on. Next, I'd like Bonnie Lacusta is an evaluation specialist with us, and she just wanted to speak to you for a couple moments. Bonnie, are you off mute?
Hi, Michelle. I'm here. Thank you. So thanks, everybody. Some of you may recall at the kickoff that you attended either in Edmonton or Calgary back in October 2017, we asked you to complete an assessment with your entire team just to get an understanding collectively of where you were on several different concepts. And you can see on the screen is a screenshot of that team assessment with the panel identification, maintenance, and management section highlighted. We promised at kickoff that we would redo this assessment 6 months later at a midpoint review to give you the opportunity to see any progress you made or highlight any areas where you may need to focus some attention. So 6 months was actually in April, a couple of months ago, so we're a little bit behind. But we decided at PaCT Central that we wanted to ask the question to you, the coaches, and say, would this be a valuable opportunity for you to do right now? Do you feel like maybe it now isn't a good time, or it would just be too much work added on to what's already a lot of work for you to do? So we thought, being an innovation hub, we would pose it back to you rather than deciding for you whether it was advantageous for you to do. So I don't know, Michelle, if we were going to do a poll anywhere or if we just wanted to hear some feedback over the phone or via the chat box.
Yeah, we don't have poll everywhere set up on this one, but we can definitely use the chat box. Or if you'd like to come off mute, of course, we welcome that.
Or if any other members of PaCT Central wanted to add to my comments, I'd welcome that as well.
And Bonnie, just while everyone's organizing, can you just maybe reframe the question one more time?
Sure. Yeah, good point, Michelle. So would you like to do the team assessment now? So you could say yes or no. And ideally, we'd like all of the innovation hubs to kind of, I guess, come to the same conclusion. So we'd like everyone to do it, or we would postpone this until the more towards the end of this innovation hub phase, which would be more likely October, November-ish. So would you like to do it now or in the fall, I guess is the question.
Okay. So thanks,
Bonnie.
Kathy. Oh, hi.
Bonnie, it's Mia. As somebody who is a little newer to the team, how long does it take to complete the assessment? And is it just this page that we see, or is there more to it?
Yeah, thanks, Mia. No, there's more to it. I should have reviewed it. I believe it's about 20 different statements. You see they're in statement pairs. I actually can't comment on how long it takes because I didn't do it as part of a team. So maybe one of the coaches could talk to us about the process of doing this with their team. How long did it take?
I'm getting some responses here.
So no would be no, we don't want to do it now. One team says they think they are ready for midpoint review. Another vote for the fall.
I'm sorry, we are still trying to log in here from Live Medical Clinic because we had a power outage. So we're still trying to get the computers working, but we can hear you on the phone.
Oh, okay, okay. So what would your response be then with the team assessment that you filled out at the beginning? Are you feeling like you're ready? You've had enough movement that it would be worthwhile doing it again now, or would it make more sense to wait a bit longer for your?
We are fine. Yeah, we're okay with that. If we have to go over that again, that's okay.
Okay. And thank you, Charlotte, for your comment. You say it took about an hour to do as a team, and you're saying you're not sure if it would give much new information on your teams. I wanted to be really clear, there's absolutely no expectation that there's been progress or advancements. In fact, in many cases, it's possible that you may reflect on your original answers and say, oh, I'm not sure that we knew enough to comment on that or that we were rating ourselves appropriately the first time. So we're really not looking for whether you've improved. Again, it's not judgment. It may just help you as a team reflect on a current state. So I just wanted to be clear about that as well. But it looks like we've had a few responses come in, so we'll take these back to PaCT Central and get back to you with our, I guess, how we'll be moving forward as soon as possible. So thanks, Michelle. Send it back to you.
Great. All right, and again, if you just were having trouble getting organized or the power had gone out or whatever you weren't able to answer, just again, pop it into the chat box with whatever your vote or comment is. And all of this, we are able to save everything that's in the chat box so we can go back later and review it. So anytime, pop something in there. All right, so test box 3, the contents, if you haven't had a chance to have a look, they are about timely access and continuity and the relationship between the two, engaging patients in care planning, team roles and responsibilities, and again, carrying further into standardizing data entry for team-based care using the EMR. So those are the topics, and now we'll go a little more deeply into each one to give you some tips on each one when you're delivering them with the teams. And starting us off will be Sue Peters with timely access and continuity. And Sue, I'll drive to slides for you if you just want to let me know when to change.
Sure. Thank you so much, Michelle. So I just thought we would start for those of you who have had a chance to look at the test box. and the test box guide for test box 3. If you had any questions, and again, there was no expectation that you would have had a chance to review it yet. It was just a PDSA that we decided we would try to see if it was helpful to have a sneak peek at the test box items before the webinar. So I just wanted to ask if there was any questions, first of all, to help guide our discussion today. Okay, did I wait for 8, Julie? So let's go to the next slide, please, Michelle. We'll just carry on then. Okay, thank you. So we are adding on to information that was provided in test box 2, talking about continuity. As we know, it's a key driver of an integrated healthcare system here in Alberta. And really, we've building on that idea of continuity and what it takes to improve continuity and get those patients better outcomes. And we know one of the key drivers of continuity and improved continuity is timely access. So the question to ask the teams that you're working with is, can your patients with complex health needs access the care team when needed, and how do you know? So in the test box, we can go to the next slide. We really, and you can go through the other the slides. I won't, or the other, yes, animated. Thanks. We're really wanting to look at how we understand what our continuity is, and how do we measure that? What are those pieces that help us understand what our continuity is? And we know that all of you are likely measuring your third next available, which is an indicator for access. And we know you've probably been measuring that for a long time. The big question is do all of your team members on your PaCT team really understand what third next available is and what it is telling you, and what is our third next available as a clinic telling us? So that's what we're really looking to do, is build a common understanding of third next available. Can we go to the next slide? Perfect, thank you. Now, the tools that, there are a number of tools that are available on the website under test box 3, and these are indicated here. We have a slide deck that will help you if you decide that your team maybe doesn't have a really good understanding of their next available and how it's measured. We have a short slide deck that you could take your team through. And also we have the toolkit for the TNA indicator, and I'll talk about that in just a moment. So let's carry on to the next slide. There's, so the toolkit, this is a toolkit that was created, it's published by Alberta Health, but it was created with the input of many, many stakeholders. And this is the supporting documentation from the Measurement and Evaluation Working Group on the best practices for measuring third next available in Alberta. And this is the reference for Schedule B indicators and PCNs reporting up to Alberta Health their third next available information. So we've put this toolkit on our website, so it's readily accessible, and we're going to point you to Appendix A, which goes through very detailed about measuring third next available. So if you have any questions about it, this would be a really good resource for you. Next slide, please, Michelle. And again, we have the PowerPoint on third next available for you on the website if you decide you want to take your teams through that. Next slide. Now there's also embedded in both the test box 3 and also the guide for the coaches is a link to a video that HQCA has put out. So we spent a lot of time in test box 2 if you chose to look at continuity and your HQCA report. We're asking teams to pull those HQCA reports out again and to look at some different items in the report to help inform access and continuity. So it's a short video. It's a great one to watch with your teams and have your HQCA report out. And one thing it does is it goes a little more deeply into looking at your report and getting an idea of what your supply of patient visits are, and also what the demand of your patient panel population is, and to look at the differences between those two numbers. Now, if you find that you have a difference between the supply of appointments that you have and the demand of your patient population, there's a number of things that can be done. And if you choose to want to start working on those right away, we're going to refer you to the AIM team, and they're ready to help in any way they can and support your team if that's what you decide you want to start looking at, is together with your TNA and your supply and demand, suggest that you would like to do some work in that area. Also, coming in test box 4, we're going to be adding to this continuity as well and giving some high-level suggestions to start working on your access if that's something you should decide you want to do. And so those will be coming in test box 4 as well. Next slide. And again, here is the link to AIM Alberta, and also you'll find it in the test box guide, as well as the in the test box itself, links to various support with AIM as well. So just remember that there's a whole team of people that are willing to help with access as well. So are there any questions about this test box item? Okay, well, if there are no questions right now, please feel free to review the content in the test box, and if you have any questions at all, please feel free to contact your improvement advisor that is supporting you and your teams if you have any questions, and we'll be happy to help out. Okay? Thanks so much.
Thank you, Sue. Fantastic. So moving along, the next item in the test box is engaging patients in care planning. And Julie, are you ready to introduce us to this concept?
Yeah, good morning, everyone.
All right.
So this section is really looking at, we know that for those of you on the call and your clinic teams that patient-centered care is not new to you. and something that you're doing well. So what we're going to spend time in test box 3 bringing is looking more at how can we build some tools and processes that can really be supportive to ensure we're aligning what we're doing with what our patients' needs actually are. And you can see on the slide, the way that we go about this is looking at obviously what we say as providers, so across the clinic team, what we're saying, but also how we're saying it. So there's been some resources that you've been given in previous boxes to help you with some of that phrasing. And we're really going to start to look at the order that we say things in. So whether that's built into a template or a process, we can order the things we're doing to better engage our patients based on their needs, and that can support us with effective care planning. So to do this, what we're going to look at is we're going to start to break down the PaCT template that's been created, but we recognize that not everyone will be using that, and that is totally okay, and something that we're understanding that there's been some modifications or people already had one, and that's good because this is part of the innovation phase, is for us to better understand what your needs are. So what we're wondering is if you wouldn't mind in the chat box, Michelle, can you bring up the rest of the animation on the slide for me? We're wondering just what you're currently using in regards to your care plan. If you are using the PaCT template, if you've made a modified version of that, or if you have already existing template that you're using. And if you want to just put in the chat box number 1, 2, or 3 that you're currently utilizing, that would be really helpful so that I can have a sense of how to share with you some of the potentially better practices that we're going to bring forward in test box 3. I see number 2 from Life Medical. Thank you. Okay, so Ariel, you said that you're using the template, but you're thinking of switching to a modified, if that's available. Yeah, for sure. We'll talk about the different pieces of it. Monica, the PaCT template. Okay, so taking some suggestions. Great. So that's what we're looking for, is your guys' feedback. And Charlotte looks like looking at modifying too from the template. Great. Thank you guys for sharing, because that's really helpful for us. There was a lot of work from a number of different stakeholders and partners to build that template, but knowing that it can look slightly different than what we're used to seeing. So having your feedback on how that's actually working in the clinics and with your patients will be really valuable for our team and for others in the province. So thanks for sharing. So we can go to the next slides, Michelle.
Sorry, Julie, I didn't realize there were more. You could have answered other or not sure, but it sounds like everyone knew what they were doing there.
Yeah, no worries. So in test box 3 of the potentially better practices that we're going to bring is, the first is around building trust and rapport. And there was a lot that was delivered in the previous test box around things like setting the scene and explaining your role, and some of those foundational pieces that can build trust really quickly with patients. And that's something that I think is really important that we want to be able to get across to our teams, is that when we talk about building therapeutic alliances with our patients, this is something that we can do quite quickly. And so those pieces from test box 2 were set up that way so that your teams could test those and trial them and see how those go, so that it can build into the way that we'll engage in the actual care planning conversation. And we know that it's not common in many templates to have something actually built in around this. So whether that's just a tick box, or if you look at the PaCT template, if you look at the very beginning, there's actually some verbiage or language to actually set that scene. And what we know through the literature is that if we don't actually have that built into our templates, it's just natural behavior for us as clinicians to bypass that, to kind of get going. And so there's a reason that that's been built in, so that it prompts us as providers to really think about setting up for our patients about what we're about to do and why. so that they're really have clear expectations of what this interaction is going to look like and can help them be engaged and know what their role will be in that care planning conversation. So that's why that's one of the potentially better practices. The second one is around strengthening health literacy. And that's really looking at building in more of the patient's why factor. So we hear a lot about this, about getting to patients' importance, and there's challenges that we often hear from teams is that it's difficult to engage or motivate our patients in some of our work. So you'll see that we've built some resources around health literacy, knowing that it's more than just delivering information. And especially in this section, we started to look at Section A of that template when we're doing things like medical assessments or summaries. How do we start to consider different ways of doing that? So a really common thing that we see is, for example, when we do things like blood pressures with our patients. Really common thing, every patient comes in that we do that with. How do we connect that information to the patient's why and to what's really important to them? And so that's where you'll see in the PaCT template some slight changes that you may not see in other templates where every time we're doing a what, so giving information, doing some assessment, asking a question, we're connecting that information to the person that's in front of us and what matters to them. And so really important that we make those linkages because that's what can build motivation and can actually support the engagement. And then lastly, in the potentially better practice is really looking at how do we assess whether patients are ready or not to continue to work with us or do the things that we're asking, whether that's, you know, in this care planning appointment, we may want them to do, you know, take a new medication. We may be wanting them to look at, you know, going and getting some lab work done, a number of different things. So how do we determine if the patient's actually ready to do that? And the template itself can be built in a way that includes that. And so you'll see in this that we'll unpack a little bit about how do we do it. So how do we phrase that as providers? And then also, how does the template make sure it's in there so we don't kind of get ahead of our patients and jump ahead and assume readiness? So those are the three focus areas for it. And you'll see on the next slide, there's been a few resources that have been built to help you bring this to the teams. If you want to just, great, thanks, Michelle. There's some more information on what health literacy actually is and how we can language that and order what we're doing to support the patients. And then another tool around what we call RIC, and that stands for Readiness, Importance, Confidence, and Knowledge. And you can see the K in RIC is small because it's really common in practice that as providers we focus a lot on information giving or that knowledge piece. So the K in this is small because it's reminding us as providers that when we're working through a care planning appointment or an interaction, that information alone isn't enough, that we actually need to consider those other four components of RIC, so their readiness and importance and confidence. And so this tool can help you bring it to the teams and help them to better understand that. And then there's also a video that's embedded in Test Box 3 that will help you look at the template a bit more to see what that looks like and how these concepts have been built into the template itself. Okay, next slide, please. And so this just shows you where you can access those resources on the top website. So just a couple, next slide, a few tips for all of you as coaches is to really just take a look at what you're currently using, whether that's the PaCT template or you're looking at modifying, and just see for yourself if you can see those potentially better practices embedded in. So will that work for you? Do you like how that's languaged? Do you think for your team it might need to look slightly different? And how might it look different? And that's what this second opportunity is to really work with your team to bring about what we call how might we phrasing. So if you're wanting to build things like trust and rapport and health literacy into your template, how might you go about it? What's working with your current template? What's not? Looking at the PaCT template, you know, how is that fitting for your team? What are the things that maybe they're finding a bit too clunky, but still wanting to make sure that those potentially better practices are included in? Okay. And then lastly, using, of course, the PDSA approach. And we really encourage the use of patient reps in doing this too. So what's the patient's experience when you're using a template like this? How are they receiving it? How is it supporting them in managing their health? And if you're running into potential barriers, talk about what is that looking like and explore that. So we'll open it up now for this section. If there's any questions around, I know that was really quick, but if you have any questions around those 3 potentially better practices or how those are built into the templates and how you may bring that to your teams. Okay, so just like Sue said, if you have questions, we encourage you to reach out to your improvement advisors who can work with you to look at the template or connect in with different members of the team to look at the different concepts that we're bringing forward.
Great. Thank you, Julie. Our next section is on team roles and responsibilities, and I will speak to this one. So, to start off, when you're working with your clinic team, if they are choosing to work on this one, recommend that you go back to the care planning current state process map that you would have done early on in this whole process. And so now would be the time to think critically about the steps involved in care planning. So are any missing? And is the process as good as it could be? Are there some areas that perhaps the team would like to expand or add to their process or even take away from the process? So this is also a time where you may want to think about reviewing the PaCT care plan template. It was very carefully crafted to follow the evidence-based guides on what constitutes effective care planning from the patient perspective and the team perspective. So this might be a good time just to go through what's in that care plan template, and does our process mirror or map all of the parts that we would like to make sure we're including in our team's process. So it can be a bit of a guide to help you with any process redesign that the team would like to work on. So that's a good place to start. We've developed a tool for you to try out. This is, again, brand new, and we really would love feedback from you on it. It's probably not perfect. It needs testing. So please, we'd love to hear your feedback on it. So this tool is to help with the care planning document. And it can be adapted to mirror the team's care planning process if needed. So we'll post it in Word form so that you can change steps in there if need be. And then it can also be used, its intention is to be used as a conversation tool and a decision-making tool. So as you go through, you can figure out, for instance, identifying patients for care planning appointments. And that might include patients who could benefit, so patients who perhaps have not had a care planning appointment in the past, and those who have had one and are due for their next care planning appointment. So again, thinking about on the clinic team, who could do it? Who is this in scope for? And some things scope will be an issue, and some things that scope won't be an issue. So who could do it? Is there anyone who has particular interest or experience or availability, so kind of who makes sense to do it? And then your decision-making columns come next. So who has the team decided will be responsible for that? And then one thing we're really trying to encourage is cross-training. So as I'm sure you guys have learned, it's a risk to have one person responsible for any process in a clinic. And so really encouraging the team to cross-train. So if that person who is most responsible is sick or on vacation or leaves the clinic, the information isn't with them, and the skill isn't with them. The skill and information are in the clinic, and anyone can step in and take over when need be. So that's basically how this tool works. Again, all the steps listed down the far left column are pulled directly from the PaCT Care Planning document. So it follows that, but again, you can adapt it as needed. And again, please, we love feedback on this. Did it work? Does it need adjustments so that we can make sure it's ready to go for the province when we release PaCT in its full, complete form. All right. This tool is available on the PaCT website. Again, please let us know what you think about it. And when you get right into the actual process with the team, it may be that the new revised process involves someone other than the physician seeing the patient as part of care planning. Or that may have been the process all along, but either way, a discussion about warm handoffs can be really valuable to the team. And so the test box includes two sets of comparative dialogues for discussion with the team, one for a warm handoff from a physician to a team member, and one for a team member introducing their role to a patient. So think about, again, when you're introducing this to the team, if you want to review those dialogues with the team, and it kind of starts the discussion with them. And then there are some guide questions for you to ask after each one if the team needs a little spurring to kind of get a little deeper into it. So the discussion for the physician handoff here, this is what's included in the test box. So again, it compares a more traditional handoff where the physician is just basically saying they're referring someone to the clinical pharmacist versus a warm handoff, and you can see the key features. It takes a little bit longer, but it's conveying that the physician has great trust and believes that this physician, seeing the pharmacist will have great benefit to the patient. So it is very important from the patient's perspective, especially if patients are used to only seeing a physician in the clinic. This is a really important step. So you might want to really emphasize this with the teams, especially if it's a clinic where patients are used to only seeing their physician. So some work does need to be done here to open patients' minds to the concept of seeing someone other than their doctor. And then, as I mentioned, the next part is on introducing your role with intention. We did talk about this a little bit in test box 1, and so we're revisiting it here in a little more depth. And so the team may feel that they've covered this adequately, but if not, this is really an optimal time to focus on how team members are introducing their own roles to patients. And again, especially if patients are not used to seeing anyone but the physician for care. So as with the previous section, you might want to think about reviewing the example conversation and then using it as a discussion tool based on the questions that are provided for you in the coach's guide. And that one looks like this. Again, so it goes from a very brief opener where the patient may or may not know what a CDM-RN is to a little more detailed introduction of how this team member can help the patient with their care. So again, consider reviewing this with the team and then using the questions to generate some discussion. Any questions about that or thoughts? Okay. Next up, Lori, are you on?
I'm here.
Okay, Lori Choma is going to explain about the data entry and standardization.
Great, thanks, Michelle. So you'll see up there in the title, it's more EMR standardization. So this, there's nothing really new in concept being presented here. We're just continuing to focus on standardizing what's going into the EMR so we can effectively search for things, that all of the team members know where to look for certain pieces of data, and also for us to be able to map to the care planning template. So I've been very interested in the conversation so far in around the care plan template this morning, so I can learn more about that and get your feedback so we can continue to make modifications to the content. Specifically, are we giving the right fields? Are we providing information about the right fields to standardize in order to map to your care planning templates? So in this section in particular, we've been just kind of going through the care plan template bit by bit and providing different areas to standardize. We're going to look at the health targets, so specifically blood pressure and BMI, problem lists, and advanced care directives. So the health targets with blood pressure and BMI, of course, BMI is your weight and height. These are fields that we've already been using with Alberta Screening and Prevention. So we have some tried and true tested processes and documentation available to you in the tip sheets as well. Some of the videos, EMR videos outline that as well. Same with the problem list. This is some work that we've already have a jump start on with documentation, and we know to varying degrees some clinics are not using their problem list at all. They don't like it. They're using workarounds in their systems, where other clinics have varying processes to clean and maintain their problem list. So there's a little bit of documentation in the current EMR guides, again, around problem lists, including a couple of sample problem lists sorry, not sample problem lists, but samples that clinics have used where they agree on a standardized set. So there's 16,000 ICD-9 codes. And so you're not necessarily going to code every single problem, but clinics have come up with a set of problems, 15, 20, 25 problems that they agree as a clinic that they're going to standardize and make sure that those specific problems are linked to a code. So those are also available to you in our EMR guides. So you can take a look at those and help your clinics to move along. As well, there's a couple of different processes available to how to do an initial cleanup and to maintain the problem list. So there's some guidance for teams around that and some questions that you can ask the team to prompt them into what process they might use. And so the third field that is in this section are advanced care directives. And we'll be more looking to you as Innovation Hub to provide us feedback on this. When we started doing our work around Alberta Screening and Prevention, around paneling and some of the disease management work, we have some tried and true processes around the other areas. But advanced care directives were new. We surveyed some of the clinics that we work with around the province with EMR processes, and we didn't come up with a lot of information. So we have some suggested processes for PaCT. We've created documents for Wolf, Acuro, and MedAccess, and the HealthQuest one unfortunately just isn't quite ready yet. It's under development, and we hope to have it up in a couple of weeks. But Michelle will show you in just a few minutes the where they are with the test boxes. So we've created some test documentation for you on advanced care directives. We'd love to hear your feedback on this. It's not around the team process for the processes for creating them. It is around just the EMR documentation for the documents that we've asked for in the PaCT care planning template. So I'll pause there before we move on to see if there are any questions around that one. And Michelle, you can just pop over to the next slide as well. Just a quick picture of the new EMR guide content on advanced care directives. Okay, so no questions. We look forward to hearing from you if the documentation we've created works in your clinics. So there they are up there for Akira, MedAccess, and Wolf, and that HealthQuest one is coming soon. Thanks, Michelle. Go to the next slide. Great. All right, so the second piece that we're going to talk about today is around filing and searching the care planning documents. And similar to the advanced care directives, we don't have a lot of documentation or feedback from clinics yet on how you like to do this work. There are, sometimes you can update the documents and save the same version. You can keep working on it. In some of the systems, you need to save a new template every time. So we are looking for you to do a standard naming convention. So at the very least, you can search for the document as well, thinking about the dating convention, how the documents get dated. And really, it's around the searchability. So you can always find the most recent version. And if you're looking for an older version, that you can find that one as well. So we're looking to hear back from you on your challenges and successes with managing the version of the care plan template. So I'll stop there, see if there's any questions. That's it for the EMR documentation, this text box.
Thank you, Laurie. I didn't quite wait for 8 there, so I'm just hanging on if there's any questions or comments. All right. Jennifer, are you available to tell us about what's next?
Sure can. And move to the next slide. Oh yes, we did mention this, and I realized we have a couple minutes. We did mention this at the last Share and Learn for those that attended, but just a reminder about the Accelerating Primary Care Conference coming up in the fall, so November 29th and 30th. And certainly we see good alignment with the work happening within PaCT. So if you are interested in putting in an abstract for either a poster or a verbal presentation, please let us know if you have any questions or want some assistance with that. Members of PaCT Central would be happy to help with that, and we'd love to see some of the work shared at that conference. Next slide. So these are just showing some of the dates coming up. We've got the materials posted as mentioned. Next thing is for you guys to get that out to the clinic teams. Please let us know at any time if you have questions. You can get a hold of your IAs, and they can bring in any members of our PaCT Central team if you have any specific questions about the content. And then the next Share and Learn is at the end of July on the 26th, and then we'll have the coaches prep webinar on August 2nd for test 4. And we'll again try and get the materials posted for test 4 before that date.
Great, thanks, Jennifer.
Anything else?
Yeah, and we're just right at 1:09, so again, your improvement advisor is available to you if you need any follow-up or you have any questions, or of course you're welcome to contact any of us here at PaCT Central. We're also available to you anytime. We look forward to hearing back from you about what your teams think of the new materials, and we, again, welcome any and all feedback as we're working on developing PaCT. You and the Innovation Hub teams are so critical to us learning what works and what doesn't work. So, again, thank you so much for all of your efforts. in helping us with that. Hopefully you'll all have a chance to get out there and continue working with your teams, and those that are ready, you can start delivering the TestBox 3 materials as soon as this next week. And we look forward to hearing from you at the next Start Learn. Thanks so much, everyone.
Have a great day.
Thank you very much.
Thank you.
Thanks, everyone.